Today, I want to talk about SLC6A4. That's one of the genes on the panel that I look at, and it has to do with how serotonin engages in the brain, and there are a whole bunch of different other aspects to it. First of all, you don't need to know this, but SLC6A4 stands for Solute Carrier Family 6 Member 4. That's where they come up with these crazy genetic acronyms, but a lot of people call it the serotonin transporter gene. And I'm going to get into that in just a minute. So what I'm going to cover are serotonin transport, receptors, stress, which is cortisol, fear response, trauma, risk aversion, optimism. I'm going to do it all in less than 10 minutes. So let's go. First of all, SLC6A4 got a lot of attention because it helps code for something called serotonin transporters in the brain, and that's what SSRIs target. SSRIs, as you know, are popular antidepressants, and the way they work is sort of complex. You can watch videos elsewhere about it, but they do engage the serotonin transporter with the goal of getting more serotonin to the receptors. Originally, there was a theory that if you have a problem with the SLC6A4 gene, that you're not going to be able to have SSRIs working as well. So you would need to take higher doses to get them to work, and then you would have more side effects. That turned out to be mostly true, though not universally true, and that was because they didn't have the full picture yet. After a little bit of controversy where people were saying maybe that's not how it worked, the scientists dug in and found that there were two genes working together, one of them having to do with the serotonin transporter, and the other one having to do with a serotonin receptor, and that better seemed to explain the whole picture there. It is an important gene when talking about SSRIs. And if I see an SLC6A4 variation, I may want to switch to a non-SSRI since they're trying to target the serotonin transporter and those receptors, and the variation in the SLC6A4 gene might make it so they're not going to work as well. So that's some of the science. Let's talk a little bit about what's going on that you might be a little more familiar with. So a lot of people have heard the word cortisol, either from ads or conversation. They think of it as this chemical that causes belly fat, which can be true to a certain extent. But in the world of psychology and psychiatry, we're thinking more of cortisol as a substance that creates stress for people. The higher the cortisol, the higher the stress, the higher the stress, the higher the cortisol. You don't really want cortisol. Cortisol is one of these chemicals that would kick in if you're under threat, under physical threat. So it's a very old chemical in our system, but it's not that useful in an environment such as an office or a school or a relationship at home. You don't need a chemical in your system to help you recover from bleeding or an infection and being able to get away from a pursuer. So cortisol doesn't help us that much. It would be great if we could bring it down. We don't have good medications to reduce cortisol, mostly because if you try to reduce cortisol through a change in your chemistry, it's going to cause other chemicals to get out of whack and cause other side effects. The best thing to reduce your cortisol is the various behavioral approaches, whether it's meditation or yoga or exercise or biofeedback, something you might clip on your earlobe and use an app for, and then get your cortisol level to come down by engaging in one of those systems. So that's what cortisol does, and it seems that people with this SLC6A4 variation tend to have higher levels of cortisol and more stress. And that's something I see. I see the different variations in the gene where the more variations somebody has, the higher their stress levels, and the fewer number of variations they have, the lower their stress is going to be. So that really does play out clinically in my practice. And that's one of these interesting things to know if you see an SLC6A4 variation, what you're dealing with somebody. Okay, so that's the stress piece. Let's talk about fear response. So scientists have been looking at animals and humans with various variations of the SLC6A4 gene, and they are seeing a difference in how fear is handled. They see a change in something called bradycardia. They see changes in the freeze response. So it really is connected to fear. And I'm going to talk about that when I talk about risk aversion. SLC6A4 really does play a role there, and that seems to contribute to trauma. So trauma is something that occurs when there's a big threat, a big shock. The issue with trauma is that it tends to make changes in a part of the brain called the amygdala, which is a tiny little organ right up here in the brain. And So it tends to make changes in that part of the brain, and those can last almost forever. You have to then extinguish that long-term learning that happens in the amygdala. So it's always important to try to reduce trauma when possible. And it seems that people with SLC6A4 variations, because they have a bigger fear response, they do have more trauma. Why is this important? I mean, it's important because, of course, if we can identify these things early, we can let parents know to try to reduce trauma for the children or people around the child, or as soon as someone's old enough to make their own decisions, to let them know that they should be avoiding trauma. Big news in the past couple of years when looking at this gene, it was found that there is a gene-environment interaction, meaning that people who have this gene, who are exposed to adverse childhood experiences when they're children, are much more likely to have various mental health issues across the board. And so there is a vulnerability with this gene. And again, if we can identify the gene early on, we can try to reinforce for people who are involved in the care of the children to try to reduce the risk of trauma for them, to give them the best chance in the future. Now, this didn't play out with adults so much. So it really is just the children where we're trying to protect them from adverse experiences, traumatic experiences, because it could trigger mental health issues. So going back to fear response and how it affects risk aversion is interesting. We see less risk aversion in people with ADHD, for example, where you have people, jumping off of a 10-foot wall or taking chances either in terms of their physical safety, not wearing protective equipment, being more impulsive, but also maybe in terms of relationships or life situations. So that plays out here as well with SLC6A4, because when you have less of a fear response, let's say you don't have any SLC6A4 variations, if you have less of a fear response, then you're more likely to take risks, right? So I see that when I see patients who don't have any SLC6A4 variations, which is actually rare, I'll see that they take more risks, which is sort of interesting. And also from a personality standpoint, they tend to have more optimism. Again, if you're going to live your whole life without as much fear and without as much risk of trauma when you take chances, you're likely to be more optimistic. I mean, what's there to be pessimistic about if you're not really scared or upset about the things that might be happening? So I do see more optimism with an unvaried version of this gene. In terms of statistics and what's normal, at least 65% of the population has a single variation or more. So it really is normal to have a certain amount of stress and a certain amount of risk aversion. It really is the outliers who don't have any variations and don't have the risk aversion and are more optimistic. The bottom line for clinical psychiatry on this is to think about SLC6A4 from a cortisol standpoint, from a stress standpoint, from a trauma standpoint, and to try to give as much advice as possible and recommendations to try to bring cortisol down and to try to decrease situations where stress might be increased or traumatic experiences might be realized. Usually there's not too much advice to give to the people who don't have the risk aversion and are more optimistic. You just have to try to maybe help them be more aware if they are taking risks and not realizing it. But that's separate. There are lots of other ways people can try to avoid risk, whether they have this gene or not. So I hope that's helpful. That's my wrap up on SLC6A4, and put questions in the comments.